As we near the end of Movember and a focus on men's health, it's time to talk about a subject a lot of men don't want to discuss: erectile dysfunction. And now, what many men don't know, and again because it's a topic not often discussed, is that ED can be an indicator of another situation: cardiovascular disease or worse. I spoke with attending urologist at Wellstar MCG, Dr. Sherita King, about what to look for and what to do if you're experiencing this. Dr. King, thanks for joining us here again. Appreciate it.
Thank you for having me.
It's, some guys may call this a taboo conversation, something they don't want to discuss, but really need to. A lot of people view erectile dysfunction as a purely sexual issue, and that's really not the case. Can you explain why ED is actually a broader health concern?
Yeah, so it's very important for us to remember that sexual health is health, because a lot of people, like you said, think it's taboo, sweep it under the rug. However, erectile dysfunction is a blood flow issue at the end of the day. So when you're having issues with blood flow to the penile arteries, then it means you're having those issues elsewhere.
So how can erectile dysfunction be an early indicator underlying health conditions?
Yes. So since the penile arteries are a lot smaller than those arteries that are going to the heart, to the brain, then when you're having these issues, you're going to see it there first. That's where you're first going to have the indication, because when you start having those plaques form and it's starting to block off the blood flow, since it's a smaller artery, the penis is going to see that problem first. And then it can really be an indicator for future problems such as stroke or heart attacks that could be coming down the road.
So that could be an early indicator of any type of cardiovascular disease. Right?
Absolutely, absolutely.
Now, if someone is experiencing what they think is erectile dysfunction or symptoms of this, why is it important for them to seek out a complete health workup from their primary care physician?
Yes, this is an excellent question. So I have a lot of patients that will come see me for erectile dysfunction has never even seen a primary care doctor.
Right.
Again, it's a blood flow issue. There's something going on that's causing this. ED is the symptom, it's not the disease itself. So we need to figure out what's going on. We need to figure out, are you having problems with blood pressure? Are you having problems with diabetes? Because we need to get those things under control. High cholesterol. We want to control all those things so we can prevent you from having further problems down the road.
I always kind of compare it to a car. If the gas isn't getting to where you need it to go, then there's a problem. You want to find out where that is.
Exactly. I liken it to a canary in the coal mine. So back in the day, they would take canaries out in the coal mine. If the canary passes out, that means we got to get out. So if you're having erectile dysfunction, there's something else going on.
What are some treatment options for erectile dysfunction that maybe go beyond addressing the sexual function?
Yes. So when we're looking at erectile dysfunction as a whole, we're trying to treat the underlying problems. Again, ED is our symptom. So we want to make sure we're having healthy lifestyle changes. So that's going to be the paramount cornerstone of what's going on. We want to make sure that we are treating, like we said, hypertension, if they're having problems with cholesterol, eating a healthy diet, exercising regularly. All of those things are going to help your overall health as well as your erectile function. The other thing that we want to do is some of the medications that we're using now to treat erectile dysfunction. So the PD5 inhibitors, everybody knows them as sildenafil or tadalafil or Viagra and Cialis. So those medications actually were made for coronary artery disease, but they had a lucrative side effect. So they showed that they had more effect on the penis than it did on the heart. So if we're opening up the blood vessels to the penis, it's going to open up blood vessels elsewhere. And there have been recent studies that show that it helps with endothelial health overall. Another part of erectile dysfunction that a lot of people don't talk about as much is the psychological aspect of it. So that's very important. The mind is very powerful. If you're very stressed out, if you're having depression, anxiety, you're not going to be able to really be able to have an erection because you're countering that. You're tapping into your fight or flight response. That's part of evolutionary things, is that if you're a caveman and a saber-toothed tiger jumped out of the woods, you need that erection to go down so you can get up out of there. So that's why you have issues with erectile dysfunction. So it's important that we touch on those aspects also. And then as far as like treatments for erectile dysfunction, again, the hypertension, the diabetes, and the high cholesterol, there are medications that you can be getting from your primary care doctor or even from a cardiologist that can help with those issues. But if we're treating those issues, then we're going to be treating the underlying causes that are leading to your erectile dysfunction.
Dr. King, what's the most important thing that men that are watching this should take away from this discussion about ED and its broader health implications?
Yeah, so the most important thing is if you're having ED, speak up. talk to someone. You want to like nip this in the bud early, so we're preventing you from having that heart attack or that stroke later down the road. It is important that we're treating our patients overall, their mind, body, and even their sexual health. So we need to like look at these things because it is indicators for further problems that could be happening.
And it can be treatable.
Yes, and it can be treatable. And if you want to have me back, we can talk about that later.
Okay, perfect. Dr. Sherita King, thank you so much for joining us.
Thank you for having me.